To check a finger stick blood sugar, I want to begin by performing hand hygiene. I also want to explain to the patient what it is I am planning to do. I need to gather my equipment, which includes a pair of clean gloves, an alcohol prep pad to clean the site, a 2x2 gauze to apply pressure to the site afterwards, some type of lancet and lancet device with which to prick the skin, a glucometer, and this one happens to be an AccuCheck Active with the instruction booklet, and the test strips that go with the machine that I am planning to use. With this particular glucometer, I will begin by getting a strip and the orange code key that I'll find in the bottle. I want to reapply the cap tightly. The code key slides into the machine, and then I put the strip in. We want the strip to be orange side up. We're going to push it in the direction of the arrows, and once it's in, the arrow should be hardly visible. The machine will read out a code. This one's 315, and it needs to match the code on the strips. Once the flashing blood drop appears, I have 2 minutes in which to obtain a blood sample and place on the orange square. When I'm ready to get my blood sample, I put on my clean gloves, and then I choose a site. Usually it's best if you have the patient's hand in a dependent position. If you slowly massage or milk the tip of the finger, you'll notice that the color will deepen. This means that it has a good blood supply. I'll take the alcohol swab, and since the pad of the finger and the tip have a lot of nerve endings, I'm going to use the lateral part of the fingertip. I'm going to clean that with alcohol, and I'm going to let that dry. When it's dry, I'm going to put the lancet device snugly against the finger, and then when I have a bead of blood or a hanging drop, I will bring the strip and the glucometer to the drop and gently touch it on the orange square. I don't want to smear it. 93 is within normal range for a blood sugar. I want to take the lancet or the needle and dispose of it in the sharps container. I'll remove the strip and my gloves, and I'll give the patient the 2x2 gauze to apply to the puncture site, and then I'll record my results.